just had urinary infection last month. Why am I re-getting it? Why am I re-getting it again 2 months back? So why are you not treating me properly?
When a person gets UTI, there are three important factors that play a role.
Calculus to be get stuck over here, and that is causing the obstruction to the urinary flow.
That means there is some structural abnormality in the urinary tract.
Because then they will develop resistance, and then when they really require antibiotics, they will not be effective for them.
When we consider the different coverings of kidney, there are few layers which cover the external aspect of kidney.
If the patient gets a renal stone, that has to be operated. If a patient has got a carcinoma of the bladder, that has to be operated. If the patient has got a ureteric stone that is causing obstruction, that has to be treated by lithotripsy.
The dipsticks are a little expensive, so if you cannot afford a dipstick, don't worry.
When we see the medulla region, it is having 5 to 10 conical masses called as renal pyramid.
So you have the organism related factors, you have the host related factors, and you have the environment related factors.
From that peritubular capillary plexus, the venule starts.
The laboratory tells you, first and foremost, whether there is an infection, and secondly, whether this infection requires treatment, and if so, treatment with which antibiotic.
And if you continue to give the same antibiotic, your patient is never going to respond.
So, in natural pathway of the ureter, it is at certain places, it is showing somewhat narrowing. These are the potential sites of.
Often people are using tissue papers these days. Even in our country, the tissue papers are increasing. Never pass a tissue paper over the anal area and then go on to the urinary area.
See, you do a culture after 2 weeks and you find that the urine still has grown some bacteria in significant colonies. You may have to treat it further with another antibiotic.
Do you want to face a situation like this? So you have to tell him what are the preventive steps also.